Okay.
Good morning. Hello. So if you're watching us on YouTube and Facebook, we have Good Morning Doctor today. And sitting here in the studio, we have Dr. Wong Wai Loong, who is an OBGYN, obstetrician and gynecologist from Mount Elizabeth Novena Hospital. Good morning, doctor.
Good morning. Thank you for having me on the show.
Good morning, Doctor. Later, I'm going to go on air and introduce you once again.
Yes.
Okay.
Yeah.
Because this is the Big Show TV part of the show.
Yeah.
Because we've got our news presenter reading the news right now. So right after he's done, we will
Go
actually
on air.
cross over and go on air.
Okay,
Yeah.
But
great.
there are many people watching right now. So good morning, everybody.
Good
morning.
How long have you been in obstetrics and gynecology?
I think probably about 15 years.
Wow.
Yeah.
Okay.
Yes.
Nice.
So you must have seen quite a number of OBG...
I only saw one because...
OBG what?
OBGYN. It's a very American thing, right? OBGYN.
Obstetrics and gynecology.
Here they usually just say, I'm going to go see my gynae,
Gynae.
right?
Yeah.
No, I only see one at Glen Eagles. And he's a family gynecologist. So he currently his dad saw my grandmother,
I
saw my
see.
mom,
Okay,
saw my
okay,
sister.
Oh, wow.
Dad passed away, so I'm now seeing his son. Yeah,
Right.
so it's just a family thing. And I think it's a lot easier to stick to one
Yes.
gynae for the family, right? Much
That's
like a
right.
doctor.
Yep.
Yeah.
So OBGYN is obstetrics and gynecology. So obstetrics is delivery of babies.
Okay.
Yeah. So if you are pregnant, you actually see an obstetrician. And any other thing is or female health related matters will be a gynecologist.
Is every obstetrician a gynecologist and vice
Yes.
versa?
So your specialist degree is ONG. So it's obstetrics and gynecology. So
Okay.
you can't do,
Oh, you
One
can't
or
do
the
one or the
other.
other.
but you can give up. Like me, I have given up obstetric practice
Oh,
and focused
right.
on gynecology and cancer.
I see. I
So
see, I
you
see.
don't deliver
I
babies?
don't. Last baby
okay.
I delivered was probably 10 years ago.
What made you make that decision though?
Because to subspec in the realm of gynae oncology, you need to be a bit more focused, and you don't want there's a lot of time taken for obstetrics, and you may not have the time to focus on your cancer
Yeah.
patients.
I can completely understand that.
Yeah, so you're a
Yeah.
gynecologist who specializes in oncology.
Yes.
Is that what the
Yes.
term is?
Yes.
Okay.
Yeah.
All right.
And, we hear many people pronouncing cervical
Yeah.
in a different way. So
Oh.
is it, for you, is it cervical, cervical,
I
cervical?
pronounce it cervical. I'm not sure.
You say cervical?
I say cervical.
Yeah.
yes.
Okay, all right.
Yeah.
So I found out that cervical is the way the Australians pronounce it.
Oh, really?
Cervical is the way the Americans pronounce it.
And the Brits?
And cervical
Cervical.
is the way the Brits pronounce it.
Yeah,
Really? I
so we
didn't know
weren't
that.
sure.
Okay. Well,
Yeah.
cervical for me.
Okay,
Thank you.
most of the medical industry
Yeah,
says
cervical.
cervical. Okay,
That's
we'll go
right.
with cervical
Okay.
then.
Yeah.
Yeah.
Okay.
Cervical cancer. How common is this cancer among women here in Singapore?
We're going to go on air
Are
in
we
about
already?
20 seconds.
Yeah,
Yeah.
20 seconds.
Okay, I'll ask you that question later.
Sure.
Kiss 92 Sports is brought to you by SPC. Formulated with advanced additives and friction reduction technology, SPC Level effectively cleans your engine, restores power and performance for a smoother, more responsive drive, all with greater fuel savings.
Kiss 92.
I listen all day. My favorite station. We love it.
Kiss 92.
Turn it up.
You're tuned to The Big Show's Good Morning Doctor, brought to you by Mount Elizabeth Hospitals, dedicated to providing you quality and comprehensive health care. At Mount Elizabeth Hospitals, it's possible.
Wake up in the morning. It's the way Singapore wakes up. Wake up, Glenn, Angel, and the Flying Dutchman. Wake up in the morning feeling like Kiss 92's Big Show.
Good morning, Singapore, and welcome to the biggest and best breakfast show in the world. We are The Big Show, and it's Good Morning Doctor Day, and so we welcome into the studio Dr. Wong Wai Loong, obstetrician and gynecologist from Mount Elizabeth Novena Hospital. Good morning, Dr. Wong.
Good morning, and thank you for having me on the show.
Good morning,
so happy to have
Dr.
you here
Wong.
today.
Yeah, for
thank
sure.
you for coming down.
We're talking about cervical cancer, and the numbers are not low. More than 200 women in Singapore are diagnosed with cervical cancer every year.
Yes.
Tell us a little bit more about what cervical cancer is. Let's start there.
Well, let's talk about where the cervix is. And the cervix is actually a part of the uterus. It is the gateway from the vagina to the uterus. And in the world, cervical cancer is the fourth most common cancer in women. However, in Singapore, it is the top 10 most common cancer in women. And hopefully in the next few years, we would have it off the top 10 cancer list, hopefully because of vaccinations and because of screening and education of the females in Singapore.
Right.
Yeah.
Okay.
You know, I was doing some research, and one of the ways to prevent cervical cancer is to abstain from sex. Is that
A myth, or
yeah?
is
Is
it
that a myth or is
true?
it true?
Well,
or like
okay.
if you're talking about intercourse, you got to wear a condom.
Well, cervical cancer is actually caused by an infection with HPV, and HPV is called human papilloma virus. You know, it is a virus attained through sexual intercourse, but it need not be penetrative intercourse. It can be heavy petting or foreplay. You know, so just because you have not had penetrative intercourse doesn't mean that you should not get yourself vaccinated with HPV. Yeah, so we should not abstain from sex. If not, we will all cease to exist as a human race. Yeah, we will not have any reproductive capabilities anymore.
So when you're saying that it's transmitted not necessarily through intercourse, penetrative intercourse. So where is the HPV virus carried to be able to transfer to the woman?
Well, it can be carried through the male sexual organs and, through the genital areas, So HPV can lie around that area and can be transmitted to the females.
So it's as important for men to get tested?
Yes.
Okay,
Well,
for
not
HPV.
tested, but vaccinated. So
Vaccinated, okay.
So men can be vaccinated now in Singapore from 9 to 45 years, and similar for females as well.
For
9 to
HPV.
40 for HPV, right?
It's too late for me then.
Is that right?
So vaccination starts as young as 9.
9, yes. So the essence of vaccination is you try to vaccinate someone before they have entered sexual activity.
Right.
And the studies have shown from 9 to 26 is probably the best ideal time to get vaccinated. But that doesn't mean at 27 years old or 30 years old, the vaccines don't work, But in Singapore, the vaccination schedule is from 9 to 26 years old. For
And-
females only.
Okay, sorry, just one question before we go on the Big Show TV. How long does that vaccination last?
So far, when you get vaccinated, let's say from 9 to 14 years old, you need 2 doses.
Okay.
And beyond that is 3 doses. So far, the studies have shown that, 3 doses or 2 doses is sufficient.
For a lifetime.
For a lifetime.
Okay.
Until further data comes out. And, if you need a booster, then, we will advise otherwise.
Right.
Okay.
We're speaking to Dr. Wong Wai Loong, obstetrician and gynecologist from Mount Elizabeth Novena Hospital. Let's continue to talk to him on the Big Show TV. Meantime, here's Dominic Fike with Mona Lisa on Kiss 92.
It is
it
continuous
is.
now, so now
Yes.
whoever's watching us will continue to watch us, but then the radio listener will listen to music.
Yeah.
Oh.
Yeah,
So you get
so
everything.
Everything all at
Everybody
once. So it
Off
is
air
continuous.
and off air. That's
So-
right.
Doctor, let's assume a woman has not been vaccinated.
Yes.
What does she have to look out for? What signs, what symptoms does she need to look out for?
Actually, but before that, FD, just to follow up
Okay.
on what we're talking about just now, the boys getting vaccinated. It's optional, right?
It's optional.
So how many parents actually
Know
Get
this.
they-
yeah,
get
actually
their
opt
boys.
for that, right?
Yes. So I think it is education, so we are trying to push out actively that males can get vaccinated. So far the focus has always been on females, but now males can get vaccinated and they should. So I suppose it's the duty of the doctors and, the media
School.
to spread the word.
That'll make boys who have been vaccinated more attractive, actually.
Of
Yeah.
course,
They're
because they're
safer.
safer. Yeah,
They're
absolutely.
safer. But do I have to go to a specialist to get this vaccination, or can my GP do it?
Your GP can do it.
Okay.
Yeah.
So besides being intimate with a boy or having a penetrable sex intercourse, is there any other way a woman can catch cervical cancer?
Not really.
It's only that way.
Yes.
Okay.
Yeah.
Okay.
Okay, so getting back, what if you haven't been vaccinated? What does a woman need to look out for?
Well, if you can imagine, if there's a mass or there's a tumor growing on the cervix, so she will present with certain symptoms, bleeding after sexual intercourse, foul-smelling vaginal discharge, because you can imagine if it's a tumor at the cervix, the tumor undergoes necrosis and it starts to shed all this yucky stuff, and it's foul-smelling vaginal discharge. And if it's a big mass, above the cervix is the bladder. It can press on the bladder, causing you to have urinary symptoms.
Oh dear.
Yeah.
Perhaps difficulty passing urine.
Or feeling like you constantly need to pee.
Yes, exactly. Or it can press behind the rectum and causing you to have constipation.
Oof.
So these are the locally advanced state. And sometimes it can go to the side and block the ureters, and you can get pain.
Oh, wow.
I'm feeling it already. No, I can
I'm sure
feel
it's
the
not-
discomfort.
yeah.
But what about externally? Do you get a fever? Do you start to,
Not really, but
Nothing.
in any advanced cancer, you may have some certain loss of weight and loss of appetite. Yeah, because the cancer is just sucking all the mojo out of you.
Wow.
Yeah.
I really think that more parents or boys need to know this, because I had no idea. It's
And
not
the poor boys. The poor boys go through life not knowing that they have
that
the virus as
capability
well.
to
Yeah.
pass it on.
But-
So it's not called an STD.
No,
It's not,
no,
right?
It's not considered an STD.
Oh, but
we
it
don't
is
it
sexually
is sexually
transmitted?
but we don't label it as an STD, or
Okay.
sexually transmitted disease.
Okay.
Yeah. But the thing is, the important thing to understand is that before anything turns cancer, there is a precancerous stage that the cervix undergoes. And that precancerous stage can last for many, many years, 10 to 20 years before cancer develops.
Oh wow.
So pap smear is actually not designed to pick up cancer. I mean, picking up cancer is too late already, You want to pick up pre-cancer so that you can do something about it in order to prevent this pre-cancer from to progress to becoming cancer.
Right.
Yeah, so that's where the screening program comes in.
And the screening is through a pap smear,
Yes, a pap-
specifically for HPV.
Pap smear and HPV.
Yeah, I had that last week. I went
Yes.
through both and came out clear, so I'm very happy with
That's
that.
good.
Yeah.
So the cervical screen Singapore is our national screening guidelines. From age of 25 to 29, in a sexually active female, you should get a pap smear every 3 years.
Every 3 years, okay.
And from 30 years old until 69, a HPV test every 5 years.
Okay.
Yeah.
That's reasonable.
Yeah.
So
Right.
25 to 29, you said pap smear every,
Every
3
3
years,
years.
but no HPV test?
No, because HPV is very common in this age group. But just getting a HPV infection doesn't mean that you will get cervical cancer. An infection is an infection. And majority of females actually clear this infection on their own.
How?
Through your own immunity.
Okay.
So if you can imagine, just like COVID, COVID affecting a young child or young person, an active, fit young person, will clear the virus within 5 days. You don't get any symptoms. But the same virus affecting the elderly may end up in ICU with pneumonia. So it's your immunity that actually clears the virus.
I see.
Unfortunately, there is no magic pill that we can give to clear this virus. So the important thing is, why don't you get yourself vaccinated to prevent this virus in the first place, rather than to treat the virus when you get it.
Okay.
So I understand the concept of the pap smear, but what is an HPV test?
The HPV test is the same way we do the pap smear. We put a speculum through the vagina, visualize the cervix, take a brush and just scrape the surface of the cervix and send it off to the lab. So you can either send it off as a pap smear, and that the results will be the specimen will be given to the lab, and the technician will actually look at the cells and see if there's any abnormality. But HPV, you can also send it for HPV test, and that actually tests whether you have the high-risk HPV or not. So you must understand that HPV, there's many strains of HPV. There are up to 200 strains of HPV.
Oh my
But we are
goodness.
only concerned with the HPV that causes cancer, and that is the high-risk strains. So the vaccinations provide protection against the high-risk strains of HPV, the cancer-causing strains. The non-cancer causing strains we are not so worried about. They can
Okay.
cause genital warts, which are not cancerous.
Okay. You were saying that between 25 and 29, the chances of getting HPV is quite high,
Yes.
right? If someone say a girl just clears it out, her body just clears the HPV out and she's healed on her own, is there a chance that there are traces left behind to later on get cervical cancer?
It is always a possibility,
Okay.
yes. But as long as you clear, the important thing to get cervical cancer is persistence of the HPV.
Right.
So you can always get reinfected again. with
Okay.
the HPV, but it's the persistence of the HPV that causes cancer. And if you can't clear the HPV from the system, that's how it starts to affect the cells, and the cells undergo changes, and cancer develops from there.
Yeah, that's right. Don't be promiscuous.
Just 1 second. Just 1 second.
Kiss 92 traffic.
On the AYE towards the MCE right after the PIE exit, avoid lane 3. A vehicle's having some trouble there. Also on the BKE towards Woodlands after the Dairy Farm Road exit, same situation. A vehicle has broken down. And finally on the MCE towards the AYE, an obstacle, not quite sure what kind of obstacle, has been spotted after the Marina Coastal Drive entrance. Avoid lane 4. Wherever you are this morning, stay safe.
Good morning and welcome back to The Big Show and The Big Show TV. We've been having a very interesting conversation with Dr. Wong Wai Loong, obstetrician and gynecologist from Mount Elizabeth Novena Hospital, about cervical cancer. And I think what we've established, and if you want to take a listen later, you can either watch us once again on Facebook or YouTube, is that promiscuity raises the risk.
Indeed. Yes, it does.
Yeah.
And
Promiscuity, having sex at an early age, smoking,
Right.
because smoking lowers somebody's immunity.
Immunity.
And all these are immunity driven because it's a viral infection.
Right.
Right. So, and anybody who is taking immunosuppressive drugs, organ transplant, these are all risk factors for getting cervical cancer because of the HPV infection.
what exactly does HPV stand for?
Human papilloma virus.
Human papilloma.
You didn't know
virus.
that? I knew that.
Right, of course
Is
you did.
there a national campaign to do something about the HPV virus?
Oh,
Do
well,
we have a national
Yes,
campaign?
we have many avenues. We have cancer societies, we have Singapore Colposcopy Society, and all these societies actually try to promote HPV awareness, and we have public forums and education to the GPs and to the specialists as well.
But a lot of them are targeted at women.
Yes.
I feel like it needs to be targeted
Targeted
at
at
the
men.
men as
Yes.
well, because
Yeah.
without the men,
Yeah.
it cannot happen.
Yeah.
Am I right?
Yes. So we should target on herd immunity,
Both,
and we try
yeah.
to vaccinate everybody.
I had
Yeah.
no
Yeah.
clue. No clue that the men could get HPV
I want to get
vaccination.
vaccination.
I think
but
you
now
should.
I'm too old to get
It's
vaccination,
okay.
Dr. Wong said.
You're never too old for a needle.
And he
Yeah.
loves his needles
I
anyway.
love
Yeah.
my
He loves any chance to get vaccinated. Just going to our WhatsApp channel right now, because there is a question from one of our listeners. And Michelle has said, "Good morning, Dr. Wong. Schools now give the vaccination to girls, but is it true that the vaccination does not cover as many as the vaccination can at a private doctor?" I think you'll know what she's talking
Yeah.
about. Can a teen then take additional vaccination if she's already taken the shots in school?
Okay, so there are two vaccinations in Singapore, Cervarix and Gardasil. So Cervarix covers two HPV infections, type 16 and type 18. And type 16 and type 18 actually encompasses 70% of cervical cancer. The other vaccine is Gardasil, and that gives you a protection of 90%, and
Wow.
it covers 9 HPV strains. So the schools, yes, they vaccinate against type 16 and 18, whereas in the private sector we vaccinate against the 9 strains of HPV. Once you have committed to one type of vaccine, you should not actually mix it. Yeah.
Oh.
Yeah. Anyway, 70% is very good. Even if you have vaccinated your girl or vaccinated yourself, and when you have started sexual activity, you should still, very importantly, continue your screening. So you still need to have your HPV test and your pap smear even after you get vaccinated, because it's not 100% protection.
Yeah.
Right? 70 to 90% protection. But the rest, you have to pick up through HPV testing and pap smear testing
I see.
at an appropriate age.
Okay.
Okay. All right, let's continue to talk to Dr. Wong on The Big Show TV. It is 8:19.
Kiss 92 Time Check brought to you by
So let's talk about treatment. How treatable is cervical cancer?
Okay, let's move back a bit. As I said, there's a long precancerous time or stage before this becomes cancer. Now, pre-cancer is highly treatable, and actually the Pap smear or the HPV test is to pick up pre-cancer, and it can be treated very easily just by cutting a small area of the cervix out, or even burning that area of abnormality. But once it turns cancerous, then it's a bigger problem already.
How long is this time period you're talking
10
about?
to 20 years.
Wow,
So
so
there
that's a
should
long
be
time.
so there should be no excuse.
Plenty of time to detect it.
Yeah, exactly. And an important thing is that cervical cancer is not hereditary.
Okay.
Unlike other cancers which are hereditary, cervical cancer is not. It is HPV driven. It's an infection. So just prevent yourself from getting infected
Right.
by getting the vaccine. And even if you
Testing.
do, you go for your regular testing, HPV and Pap smear, and should there be any abnormality or precancerous change, a lot of things can be done. And it's highly treatable. We do not want to pick up cancer. It's important. We do not want to pick up cancer. We want to pick up pre-cancer where it can be treated. Right? There's no point picking up cancer and it's a little bit too late already.
Right.
So I have a question. If the pre-cancer period
Yes.
is so long, why are there still so many people getting cervical cancer?
Because they do not go for screening.
Okay.
Many a times when I see patients in my clinic, I ask them, when is your last Pap
Screen.
smear or HPV test? Oh, when I delivered my child. So a lot of what we do is opportunistic screening, meaning that you come to the gynae and for whatever reason, perhaps irregular menses, and we ask, when was your last Pap smear? Oh, I can't remember, many years ago. Then we
do
start
it.
doing. Yeah. So it's quite sad, we don't have a robust program to capture all these women. So a lot of women can't even remember their last menstrual cycle,
Yeah.
let alone when 3 years ago my Pap smear or 5 years ago was my HPV test. So
Yeah.
Okay.
unfortunately it is what it is.
Yeah, but I feel so bad for the women because they have so many things to
Too
worry
many
about.
things to worry
Oh my
about. When is your
gosh.
last menses? When was your last HPV?
Yeah.
When was your
Yeah.
last delivery?
Yeah, like I mean, I've gone through menopause already, and I went to my gynae last week, and he's like, "When did you stop?" I'm like,
Yeah.
no idea, no clue at all.
Yeah.
So it's not something that you take
Yes,
down,
that's
know,
right.
Yeah.
and remember things
Yeah.
Yeah.
about. But yeah, I think it's very important to get the message out to the men
Yes.
and the boys and the parents of boys
Yeah.
about getting the boys vaccinated as
Yeah,
well.
because I think what we've learnt this morning is, correct me if I'm wrong, this is probably one of the most preventable cancers that there is.
You are absolutely right. It
The
is-
number can be 0 for
It
cervical
can.
cancer.
If you think about it, if we could vaccinate our population like how we vaccinated COVID,
For COVID,
Yeah.
well, we would have probably maybe close to eradicating cervical
Cervical
cancer if you think about it.
And
Wow.
why aren't we doing that?
Because there's no, it's a
There's
it's
no
policy
need?
thing.
Yeah, you can't force someone to do to get
Yeah.
vaccinated.
Yeah.
What if there's
Yeah.
a side effect?
Yeah.
For example.
Are
Yeah,
there side
right.
effects to the
Well,
vaccination?
I mean, we have vaccinated many billions of people around the world, and there's no real adverse effect. Of course, there may be pain, there may be swelling,
Fever.
fever, all that normal stuff. But really, it's quite safe. It's very safe.
Yeah.
It's
If that's the
very
case, then we should push for it.
Yeah.
Yeah.
We should be
for
pushing
sure.
for it.
I think it's very important.
Yeah.
Very, very important. Anybody who
Absolutely.
has boys in their families, I mean, if you're listening to this,
Yeah.
definitely something that we should consider. So, okay, get vaccinated, everyone.
Yes.
Yeah, Glenn, go for your vaccination.
I would love to.
Yeah, just go.
But really, can I? I'm
At his
54
age?
already.
Well, I mean, the licensing doesn't exceed beyond 45.
The
Yeah.
licensing does not
Yeah,
exceed.
because the vaccine companies are the ones that
They say the age
promote.
group.
Yes.
Right. Okay. So he cannot
Oh.
even if he wanted to. Or
I
he
suppose you
can.
can, but it's off-label. All these
Right.
things that you do, out of the ordinary, is considered off-label use.
Yeah.
Okay.
So for someone, let's say, okay, who's below the age of 45, who's eligible for this shot. So if he has like the HPV virus in him after getting the vaccination, it'll be gone, is it?
No. Okay.
Oh.
Vaccination is not to treat
Cure.
the virus. Vaccination is to prevent yourself from getting the virus.
Right.
So whatever virus that you have in your system currently, the vaccines do not help. Right?
Oh.
Yes. It is to prevent the other viruses from coming in and infecting you.
So
Yeah.
how do the boys test for HPV?
We
then?
don't test the boys for HPV.
Oh.
Yep, we just vaccinate.
But what if they
Currently.
have HPV?
What if they have HPV?
Yeah.
You know, well,
You know what I mean? If they have it,
the,
then
the
they
important thing is we try to vaccinate everybody
Before.
sexual activity.
Oh,
right?
okay.
It's almost like once you have sexual activity, there's a big chance that you have
Yes.
HPV.
Well, I
already.
mean,
No, is there really for the
no,
men?
Not really. I mean, depends on the society that you grew up in. You know, in a very promiscuous
yeah,
society.
which is why the word is promiscuous.
So
then
how
yes.
do men get HPV?
Well, I mean, it's sexual activity. So
Reckless
you know,
sex.
you pass it around from women
Yeah.
to men.
You don't know
to
who
It
women.
your
keeps
partner
going
is.
Men
round
to
and
men
round
as
and
well.
round. Right?
Yeah.
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 Okay. Okay. But that is interesting though, because I feel like if you can test, because a lot of boys at this juncture listening to us, it would be too late because they're already sexually active.
Yes. So,
So
you're
if-
trying to catch the population
Before they-
So it
that.
takes time now to reverse the clock.
So
and
it's
try
for
to
the
catch
young
them.
ones
It's for the
now.
young ones
Yo-
growing up.
Yeah,
Like then you may be
Past that stage.
past that stage. You know.
Yeah.
Yeah, my rock and roll lifestyle is over.
But for the parents who have children in boys in
9,
particular
yeah.
in primary school,
Yes.
now these are the people they need to get their boys vaccinated.
Yeah.
So 9 to you said
9 to 45.
9 to 45. Okay.
9:45, but it's not in the national immunization schedule for males.
Yeah.
It's only for females. So males, if you want to get vaccinated, it is with your GP or with your.
It's your own responsibility,
Yeah.
basically.
Yeah.
And of course, I mean, they'll need their parents' consent
Yeah,
as well.
of course.
Above a certain, below
Yeah.
a certain
Yeah.
age. Yeah.
Wow. Wow.
Interesting, huh?
We've learned something
Yeah.
new this morning. Men are the cause of.
A lot of things. We knew that already. I mean, but unfortunately, we need you for quite a few things as well. So we still got to keep you.
Changing
yeah.
light bulbs.
No, what are you talking about changing light bulbs? I changed the light bulbs in my house. Like,
Very good, very good,
excuse
very good,
me.
very good.
yeah.
Very good.
What else should we know about? I mean, this is revelationary for us. You know, boys needing to get the vaccine.
Yeah. I think that the message we need to push forward is, vaccination is important. Don't wait until you get the virus to try to do something about it, And a lot of times when we check the virus, it took us a long time to even get a cure for any viral infection, It's not like antibiotics, and antibiotics is targeted at bacterial infection, your Augmentin, your Amoxil or what, It is an antibiotic, but there's no real effective antiviral for HPV at this current moment,
Okay.
So virus is very smart, it goes into the brains of the cell.
And keeps changing.
Yeah, it
right?
keeps changing and it controls the brains of the cell. So it is hard to kill off the virus, and the virus can stay latent.
Oh,
Right?
wow.
Yeah,
Okay.
it can stay latent and reinfect again.
Okay.
See, that's why the doctor is focused on this.
Yeah.
And stop delivering babies.
Oh.
When we come back, we'll talk misconceptions.
Okay.
Kiss 92 traffic.
On the BKE towards the PIE after the KJE, exit avoid lane 3 if you can. If you spot anything else, our number is 8855-0920.
Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Wong Wai Loong, obstetrician and gynecologist, OBGYN, from Mount Elizabeth Novena Hospital. Welcome to the show. And
Thank you.
It's been so...
Eye-opening.
Yeah, it's been so nice talking to you this morning, Doctor.
Thank you.
Okay, questions come through on our Facebook page from Annie Ng. She says, if one has had one's uterus removed, is there still a need to do HPV and Pap smear tests regularly? And how long between checks?
If you had your uterus and cervix, I presume, removed, and it depends on what you're having your cervix and uterus removed for. If you're having your cervix and uterus removed for a precancerous lesion of the cervix, then yes, you need to undergo a vault smear. Although the cervix is not there, but the vagina is sutured up, it's like a blind ending tube, you still need to undergo vault smears because your hysterectomy or your removal of the uterus and cervix was because of a disease in the cervix. However, if you had your uterus and cervix removed for other reasons, for example, fibroid or cyst, and you had your regular pap smear or HPV testing and that's all negative, then there is no further need for any screening.
Okay.
Okay, we've got a question on YouTube, and this viewer is asking, and I think you may have answered this, but perhaps you just want to answer it again for the radio listener. Just wanted to check in relation to this sort of medical condition. What kind of screening should the guys go for, and how often?
Well, we don't screen for males.
Yeah.
There's no screening for HPV for males.
So there's no way to detect it in
No,
a
not really.
boy.
Yeah.
Okay.
So we just vaccinate the
Okay.
boys. Yeah.
So
So you take
yeah.
your chances, women.
Yeah. Oh my God.
Woman.
That's scary,
know
though. That's so
who
scary.
you
I
are
know.
with.
I
Yeah.
can tell she's very concerned.
I am.
Just screen, boys. Go and see if you've got HPV. And
But you can't.
Yeah,
You
you
can't.
can't.
Yeah,
That's the
exactly,
thing.
exactly. But you were thinking that,
I was
right?
thinking. I
Yeah.
feel
Yeah.
like, is it possible for someone to come up with a screening? Wouldn't it make it so much easier for the
But
boys?
even if the females screen positive for HPV, that
HPV.
doesn't mean that you should not get vaccinated.
Yes,
Because
of course.
You could only be infected with one virus.
But you did say
Oh,
that if
that's
the
right.
boy has it, vaccination doesn't mean he doesn't pass it on. It's not a cure, right?
Yes, it's not a cure. It's not a cure, but it's a preventing.
Can the
preventive.
boys get a cure for
No,
HPV?
no.
Also no.
Yeah.
Okay.
There's
My
no cure for
goodness.
HPV.
Yeah. But there's so
Wow.
many strains, like the doctor said earlier on.
It could be one of the lesser
Yeah.
ones.
Yeah.
So
or
maybe
one of
getting
the
a vaccination will prevent you from
Prevent
getting
from
a
other
particular strain,
yeah,
right?
and other strains from coming in.
So just
Yeah.
vaccinate.
yeah, just vaccinate.
Just very quickly, are there any misconceptions?
Oh, yes, there are misconceptions. Well, once you get vaccinated, you do not need to enter the screening program anymore. That is,
big
you do.
misconception.
Yes, you do need to undergo your pap smear, regular pap smear, and HPV test, even if you get vaccinated. Another common misconception is I only have one faithful partner, hence I do not need to get vaccinated or
Checked.
screened. No, it doesn't mean that. As I said previously, it need not be penetrative intercourse.
Yeah.
It could be, heavy petting foreplay, in your younger days, Yeah.
Wow,
That
so you could be carrying
and
it.
you could have been carrying it. You're right.
Yeah.
Wow.
And it doesn't
Oh
mean
my
that your
goodness.
partner is.
Because it
you know,
doesn't show up for like 10 to 20 years.
Yeah,
That's what he
exactly.
said.
Yeah, man.
Oh my goodness. Okay. Go get your screening. Go get your vaccination.
Yeah, and if you want to find out even more, you want to see someone, go look for Dr. Wong Wai Loong, okay? Thank you so much,
Thank you.
Dr. Wong, for being
Thank
with
you,
us
thank
this
you.
morning. Thank you very much. We've been speaking to Dr. Wong Wai Loong, obstetrician and gynecologist from Mount Elizabeth Novena Hospital.